Would everybody please stand? Mr. Leslie will be saying the prayer and then follow that with the Pledge of Allegiance of the flag.
Most gracious and ever-giving God, we give you thanks for the work of your servant, Jeff Parks, member of the Talbot County Parks and Recreation Board and past president of Easton Volunteer Fire Department, who was taken from us in death just yesterday. We ask your comfort and consolation for the family and friends that he leaves behind, and we take this moment to remember him. We give you thanks, too, for the rich web of services and organizations in our community that serve people in need, from youth homelessness and child hunger programs to mentoring and mental health needs. Keep us mindful of the support these programs require to serve all those who come to them in need. Use our hands to do your work in this world. Guide us to offer the respect deserved by every person who comes in contact with us, that we might lift up others, and by doing so, lift up our community. Amen. Amen. For the pledge. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Risher, for that prayer, and we wish the Parks family all the best in sorrow for Jeff. I was very, very close to Jeff. We were in the fire department for 30-some years on many committees together. We designed fire trucks together, and he will be missed from a lot of people because he touched a lot of people in Talbot County, and he will be missed. He would be missed, that's for sure. So if the family needs anything, please let us know. Okay. Starting tonight, okay, the agenda. The council has an agenda before them on the 26th before us. Are there any additions, deletions, or corrections to the agenda? Hearing none, the chair moves that the agenda be accepted as unanimous consent. Okay, moving on to the minutes. September 28th, October 12th. Are there any additions or deletions or corrections to the minutes? Okay, hearing none, the chair moves that the minutes be accepted as unanimous consent. Okay, the next thing on the agenda is the disbursements. Disbursements of October 19th and the 26th. Are there any additions, deletions, or corrections to the disbursements? Hearing none, the chair moves that the disbursements be accepted by unanimous consent. Okay, so so next on the agenda is a presentation and a proclamation of the support the lights on after school. Okay, Madam Secretary, could you please read the proclamation into the record, please?
Proclamation, keeping the lights on after school. 22nd Annual Lights On After School, October 28, 2021. Whereas the citizens of Talbot County, Maryland enthusiastically support quality after-school programs because those opportunities provide safe and engaging learning experiences that help children realize their full potential, support working families by ensuring their children are safe and productive when they are out of their classrooms, build stronger communities by involving students, parents, business leaders, and adult volunteers in the lives of young people, thereby promoting positive relationships among youth, families, and adults, and engage families, schools, and community partners in advancing the welfare of our children. And whereas during the COVID-19 pandemic, after-school programs have risen to the moment to support students and families. After-school programs provide engaging, hands-on learning and opportunities to connect with caring adults and peers. During the pandemic, programs have innovated to provide remote learning support, virtual programming, care for children of essential workers, meal support, wellness check-ins, and more. Today, programs are supporting young people and families as they navigate the return to school and will continue to innovate to meet ever-changing needs. And whereas Lights On After School, the annual national celebration of after-school programs, promotes the importance of quality after-school programs in the lives of children, families, and communities. And Talbot County, Maryland advocates for community involvement in the education and well-being of our youth, grounded in the principle that quality after-school programs are vital to helping our children become successful adults. Now therefore, we, the County Council of Talbot County, do hereby proclaim October 28, 2021 as Lights On After School Day. And be it further resolved that Talbot County enthusiastically supports innovative after-school programs and activities that ensure the lights stay on and the doors stay open for all children after school. Given under our hands in the Great Seal of Talbot County this 26th day of October in the year of our Lord, 2021.
Thank you, Madam Secretary. Is there a motion and a second to approve this proclamation?
So moved.
Second.
Okay. Madam Secretary, could you please call the roll?
Mr. Pack? I'm sorry. Mr. Callahan?
Aye.
Mr. Lesher?
Aye.
Ms. Price?
Aye.
Mr. Pack?
I get it.
Okay.
Mr. Carter, could we hear from this?
Yeah, get ready to call her up. Pack, get ready to call her up. She's next. Come on up, Nancy. This is Nancy Andrews, ladies and gentlemen, the Executive Director of the Family Network. And she is a special lady to us, to a lot of people. Does a lot of work for us. So, Nancy, welcome. Appreciate the hard work you're doing, and give you a few minutes to tell us what's going on. And Mr. Pack, yep. You want to give her the proclamation? Okay.
We're just going to jump right into it, right? Okay,
Okay,
Mrs.
okay.
Moran's got me set up.
Okay.
I'm not sure I can talk and use a mouse at the same time, but we'll see. Oh, there we go. Okay. So again, I'm Nancy Andrew. On October 22nd, I celebrated my 10-month anniversary as director of the local management board. As many of you know, I am born and raised in this county. It means a tremendous amount to me to be able to work in my community in this way. So thank you for the opportunity to be here tonight and offer an update on what we have been doing at your local management board. Okay. So I think it's always nice when I have the opportunity to be in front of the community to remind everyone where local management boards came from. In the 1990s, local management boards were established by the Maryland legislature and have been operating since then. Originally, our local management boards were regional, but as we have a way of doing in Maryland, sometimes eventually they were broken up on a county-by-county basis. And there now is a local management board in every county in Maryland, plus in Baltimore City. So essentially, it's a mini children's cabinet in every county. Talbot Family Network was established in 1997. And while at one point we were operating under the Governor's Office for Children, today we operate under the Governor's Office of Crime Prevention, Youth, and Victim Services. So just another point, often we're doing our services through supporting other organizations, and the community isn't as aware of our work, so I just want to remind everyone why there is a local management board. And the emphasis is really on local decision making. I think all of you can appreciate that when decisions are often made on a statewide basis about programs impacting children, families, and our communities, when they're made on a statewide basis, is often the voices from the larger counties, the more suburban or urban areas that drive decision making. So the establishment of local management boards made it possible for us to look at local data, to engage our local board of directors and other community members in making decisions about how funds are used. Who serves on our board of directors? We do have some mandated board members among our group of 15. Of course, Mr. Pack serves on our board, but we also have representatives from all the child serving agencies in Talbot County. That's true for every local management board. So that includes Dr. Maguire, our health officer, the superintendent, the director of social services, the director of juvenile services, And we also have representation from the Core Service Agency, and currently Katie Dilley is our board president. We have representation from law enforcement as well, and then the balance of our board is made up of representatives from nonprofits in the community and other just concerned community members. A list of our current board is on the Healthy Talbot Family Network website. And just as a reminder, when we do have openings on our board, our nominating committee is activated. We make recommendations on candidates, and then those are sent forward to the county council for approval. So in FY21, I love in that proclamation how it says programs innovated. Our community was the same here. When COVID hit and everything shut down, the programs that we fund are about relationships. The programs that we fund are largely impacting under-resourced households, children, and families. And so the challenge of pivoting and suddenly trying to deliver services in a virtual space was very challenging. But I'm pleased to say that our programs were very successful in that. Since we started out with the proclamation about after-school programs, I just want to point out at the top of the list, the Healthy Habits program that's run by Chesapeake Multicultural Resource Center. That's a research-based program, an evidence-based program using SNAP education that Chesapeake Multicultural Resource Center runs out of Easton Elementary School. This year they have 68 students K through 5. But last year, to keep the program going when school was virtual because they couldn't be out of Easton Elementary School, staff came up with the idea that every week they would put together a food resource box to take to the students, to their families, to engage the kids virtually over Zoom in educational activities about nutrition. So it took a tremendous amount of work on the part of the staff, but it was very important for them to continue the program and above all, continue the connection with the children and families that they have through that program. Also from the list of programs that we funded last year, I want to draw to your attention the program that Talbot Family Network has funded with Talbot Mentors called Mentoring Youth and Supporting Families Impacted by Incarceration. Several years ago, when Talbot Family Network was doing one of its community survey processes, where we go around and collect data from all sorts of sources and sectors of the community, some of our board members went in and partnered with a detention center to talk with parents there to find out what their concerns are about their children. And what they found out is that, yes, those parents were interested in one-on-one mentoring services for their children, but they were also interested in additional support services for the parent that is on the outside and raising that child or the caregiver. So we awarded funds for that program for several years for Talbot Family Network. This year, they came to us and they said, thank you, you helped us get a program started. We're ready to keep it going on our own, and we're not going to apply again. So that's really the win-win of a local management board, when we can help start a program and either address a need or seed the program so eventually the organization can take it on. One thing that makes a local management board different from, say, just a foundation in your community is we are required to respond to the governor's priorities. So the priorities that Governor Hogan has said are listed on the screen there. We call these our result areas. And the top 3 in bold are the ones that our board of directors has chosen to focus on because of the data in our community. So improving outcomes for disadvantaged youth, age 16 to 24, increasing opportunities for community-based programs and services for youth and families, and reducing childhood hunger. Also, the 3 items at the bottom of the screen, just to share, our direction from the state has been very clear that they ask us to focus on these areas with every program that they fund. And that direction was even more clear in FY22. We were told that these were a lens to apply to every program. I'm going to keep hitting the wrong one. So for FY22, the programs that we have funded are listed on the screen. I do want to point out Career Pathways is a program we had attempted to launch in FY20, then COVID hit and we weren't able to get it off the ground, but we were fortunate to have funds available this year because of the change with Talbot Mentors to make it possible to put an RFP out. We received several applications of possible vendors, and that's been awarded to the Neighborhood Service Center. So that's a program that will target disconnected or opportunity youth, age 16 to 24, who currently aren't working. and help provide them with some soft skills training, resume building to help them get a job. The nice thing about that program is it dovetails really well with the re-engagement coordinator at Talbot County Public Schools, who works with students who have dropped out to help re-engage them in education. So there's a nice win-win there in programs working together. I also want to point out for you our local care team. Every county, just as we have a local management board, has a local care team. I often say to families, if your family doesn't need the LCT, then you probably never know about it. But for families that have children that are struggling, often children who are involved with multiple agencies, the LCT is a resource team. It's a problem-solving team. There's representation from the major child-serving agencies in the counties, plus some other partners who come together and make sure that there's a coordination of services between all of those different departments. And then Healthy Talbot is our resource directory. It's online. It is in print. We're in the process right now of updating the print version, since there really hasn't been a need for print versions during the last year. But the county does provide us with some funding that helps support that resource directory. And as we see the community open back up and there are more community events, we'll be excited to get this resource back out into the hands of our community members. So that is just a very quick update. I again appreciate the opportunity to be in front of you. I'm certainly happy to answer questions. I'm also here to come back at another time to be more specific, but I wanted to make sure that my contact information is out there so that the community knows if you have questions, we are certainly happy to meet with you and answer them.
Okay, thank you, Nancy. Council?
No, our conversation, man, is long, it's long overdue.
Oh,
We did that.
Ms. Price?
I'm good, thank you very much.
thank you.
Just thanks for the good work that you're doing in the community and the other organizations that through your work you're making possible. Some really important work going on out there, and it's good to have this update. Thank you.
It's great to have it, and we appreciate everything, and we would like, Mr. Pat would like to give you
Yeah, before I come up, I would like to ask, with the Lights On After Dark initiative, is there anything being planned? That's on the 28th, that's what, Friday? No, Thursday? Thursday. So what can you tell us being planned for that day?
We haven't planned any special activities. I think, one, it's just our programs this year are so happy to be back in the schools and being able to operate on a full-time basis. We really just wanted to remind the community about the importance of after-school programming. We're hearing that the back-to-school time is causing such readjustment for everyone, and we focused a lot on having schools back open, but reminding the community the importance of having that after-school time be addressed as well.
Okay. All right. Well, does anyone else have any questions? If you don't mind coming on down.
Thank you.
Nancy, that'd be great.
Here we go. Nancy, thank you very much for all that you are doing with the after-school program.
I'm smiling and I'm so taken with just his thumb.
Okay. Okay, thank you, Nancy.
Thank you.
Okay, next up is a presentation of the FY22 Senior Care Plan. Kate and Dr. Maguire, if you come on up, that would be great. Are you guys? I'll turn it over to you guys.
Thank you very much.
Yeah.
I'm Kate Stinton. I'm a nurse and a social worker at Talbot County Health Department. And thank you for the opportunity for us to come again and talk about the senior care plan for Talbot County. This is a program I've been involved with for over 15 years and also was a student intern, was involved with it years ago. So I'm a huge fan of this program and what it does for the county. So just briefly, I'd just like to give a brief history of the program and the purpose, what we do uniquely in Talbot County with this grant money, and then some statistics about who we serve and what we do here in Talbot, and then just some examples. So again, this is a grant actually offered through Maryland Department of Aging. It's offered in every jurisdiction, and the beauty of it really is that they allow each jurisdiction the opportunity to sort of design the program to meet the needs of the particular county. We are one of 2 counties in the state that directly get, where the health department directly gets the funds from this particular grant. So our design is a little unique here than it is in some other counties. In most areas, either the Area Agency on Aging, so for us that would be Upper Shore Aging, or the Department of Social Services would be the lead agency to accept the grant money and administer the program. So Talbot and Allegheny are the 2 that kind of directly get the money. As a history, Talbot was the pilot center for this project. Back in 1982, at that point in time, the grant award was $243,000 a year, which was phenomenal. And we successfully administered that through 2014, serving seniors in the county, again being the lead agency as a health department. And then there was some funding reallocations at the state through Department of Aging. And based off the reallocation on census and numbers, poverty level numbers and senior numbers, the grant was cut in 2014 to $100,000. So that was a substantial cut for the program and for the seniors we served here. And at that point in time, we came before the council and asked if we could allocate some of the health department funding to this program to make up the deficit, and the council did allow us to do that. So the Department of Aging increased the grant from the $100,000 to $115,000 in 2019, and then the county has helped us supplement with $50,000 every year since. So that's our total grant funding. A little bit about the program. The intent of this program is to provide coordinated community-based in-home services to help those seniors at risk of nursing home placement. The hope is to improve quality of life and to defer the need to go into a nursing home and to go on Medicaid and to stay successfully in the community. Those eligible for this program are 65 and old, seniors that are 65 and older. They have some functional disability, which means they need assistance with their activities of daily living, ranging from, it could be from just managing their home and doing chores up into needing assistance with ambulation, bathing, hygiene. And there is income criteria, which is roughly about 300% of poverty level to be eligible for this program, so it's pretty generous. For example, a senior can make up to around a little over $3,000 a month in income and have up to $11,000 in asset, still be eligible for assistance through this program. But it's really meant for those that are not able to. It's a program of last resort. So if people aren't able to get their needs met through other programs, the senior care program will come in and assist them, and as long as the grant dollars allow. It does provide assistance, monetary assistance with providing personal care, chores, potentially adult daycare, financial assistance for medications, nutritional support, emergency response systems, and in my book, the case management care coordination. So we are able to guide some of our seniors that enroll in the program to basically get their needs met. They're the drivers. It's a volunteer program. If they decide they need assistance, we come out. We provide all services in the home. We meet with them in the home. Our staff do hundreds and hundreds and hundreds of home visits a year, providing ongoing support to folks in this program. Again, it fills in, they call the funds gap filling because it fills in the gaps, providing services that can't be gotten anywhere else. And in fiscal year 21, our participants ranged anywhere from an average of $15 a month up to about $300 a month in support. So there's a wide range. A lot of the folks we come in contact with might not know they're eligible for services. So our team will work with them, help them enroll in programs. A classic example would be somebody on Medicare that's low income, they may not be aware that there's some low-income Medicare plans that will pay for the cost of their Medicare B, get them in subsidies for their Medicare D that pays for medicine. We can help them enroll, saving money in their pockets and hopefully help them manage issues at home. Some of our seniors are alone, have no family support. Some have a lot of family support and just need some extra assistance. And some have, family that live remotely and aren't able to come and help them with some of the day-to-day. So those are all folks that we serve here in Talbot County. Again, why is this important? I think this program's important because it does help people stay home longer, which hopefully I would think most of us want to do as we age. We want to age in place. And the other thing is the cost of the average cost of a nursing home per day right now. Someone on Medicaid is about $225 a day. So as folks are not doing well at home and they spend down their resources and end up going into a nursing home, that's costing the system and Medicaid a lot of dollars. So whatever we can do to improve quality of life, help people stay in the community, and either defer or some cases prevent going into a nursing home. This is one of the programs that can help do that. So what we do different here in Talbot is we've merged this program into an existing program at the health department called AIRS. And it's a team of nurses, adult evaluation and review services that's in every health department in the state. This is a team that already goes out and does evaluations and assessments and works with people in the community to help them, to steer them into services and programs that can help them. So we've merged the senior care program into the AIRS program in Talbot County. And what that does for us is it reduces duplication of effort. We already have a team of people going out and visiting with folks and doing evaluations. So now we've teamed that with senior care, so now they actually have funds to help people to also access services. They're not doing an evaluation and saying, this is what we think you need, but we really don't have any way of helping you. We'll have to refer you. But they can actually stick with them. They can start services. They can enroll them in the program on the first day they go out and visit. So it's really a way we've sort of incorporated the programs, which helps saves money for the program. The staff costs are shared because the staff positions already exist. And what that means is more of the grant money can go directly to our seniors and the services that they need. So that is fairly unique in Talbot, and I think there's some indications that show how successful we are statewide. One thing is most counties with senior care program with the limited funds carry wait lists. They get a lot of referrals and they're unable to go out and see them and start services. In Talbot County, we don't carry a wait list. Even if the funds are limited, we're still able to go out, provide case management, be a lifeline, work with folks, and get them connected as best we can. The other thing is there was an audit done by the state for the senior care program in 2019, and to me this has always been a big indicator of our success, is out of the $8.5 million roughly budget for this program statewide through Department of Aging, we received 1.3% of the funds, but we served 5% of the participants. So we're able to do that because of the way the program's designed and incorporated into other programs. We just have more staff already going out in the community that can help us pull this program off. Participation is voluntary. Most of our referrals come from the clients' families and community. And the other thing to stress with this program is that, we know that no one program or one group can pull all this off to help people, stay healthier at home. We have strong partnerships with everybody in the community that we know of that serve this population. We're active with the Talbot County Commission on Aging. We sponsored a senior supply drive. We're still getting donated incontinence supplies. That's helping, since they're donated, that's an expensive item. We don't have to use grant money to purchase it. We're able to assist some of our seniors with incontinence supplies. We have strong partnerships with Upper Shore Aging. We have an agreement with Upper Shore Aging to administer this program. So we get a lot of support from them in kind. We work with the Senior Center, Department of Social Services, their adult services group, and our group work closely together. merging funds, Neighborhood Service Center, Society of St. Vincent de Paul, Union Dorcas, St. Mark's, I could go on and on. Community for Life, we do scholarships for Talbot Community for Life and get volunteer help. Bay 100 Community Volunteers is another one that's doing some home modifications, putting ramps in for our folks. So, you know, there's a long list of people I probably haven't mentioned that we work together with on a daily basis to provide support and prop up our low-income seniors that are having difficulty managing the community. And then just to kind of move on to who we serve, and I think there was some documentation I forwarded that has this, and to me it's pretty telltale of what we do. We serve 221 seniors in fiscal year 21, and we're growing at about a rate of 5% a year, so we're increasing our number of seniors that we see and support. And with the $165,000, you know, we spend it every year. And as far as the funds, right now, 8% of the total funding is going to administrative costs, 25% to staff, and it does pay for 2 part-time social work case managers that help us as far as boots on the ground, getting things done in the community. And then 67% of the funds go to gap filling, which is providing direct services for our clients. So out of the 221 we served in 21, who we served 68% are female, 43% Black or African American, 65% are pretty much in the Easton area, and the rest in the extended areas of St. Michael's, Trapp, Cordova, Tillman. 51% are what we consider older, so they're 80 and older. 64% of the seniors we serve live alone. And 43% have Medicare only with no supplemental insurance. So that kind of tells that there might be some financial challenges. And again, probably to start out with this, 68% of those we serve are living on a fixed income of $1,500 or less a month. And then 40% are living on a fixed income of $1,100 or less, which is poverty level. So there's a lot of challenges. And this program does help, you know, a lot of folks stay in the community longer. All have some limitations in their ability to perform their daily functioning, which is why they enroll in the program. They all get a case manager. We have the nurses that handle the medical issues, and then we have a team of social workers, case managers, community health outreach workers that will help them connect with the social determinants and issues they need help with. It could be getting IDs, enrolling in programs, applying for homeowners in property tax credits, renters tax credits. We had a team help people get some of their tax refund issues, whatever the needs are, we help them do that to support them. And just right now, the greatest need that's been reported to us by our clients is having that case manager and care coordinator come to their home when they need them or be available to them. Incontinence supplies is almost 60% of the clients. And then that chore assistance and personal care, somebody to come in and help run errands, do grocery shopping, maybe run a vacuum, do laundry. That's a huge need for a lot of our folks trying to live independently. And then just lastly, I think, for the challenges, again, the beauty is we have the nurses and the staff out there, and these are the same nurses that work with our mobile integrated health project. They're the same nurses that do our home vaccinations for COVID. They're nurses that are out in the community, connected to the community with folks getting home and community-based services. So they know the needs, they know the clients, and they're known to the community. So the fact that we've merged this into this sort of program here at Talbot County Health Department has worked really well for us. And then I just see the needs in the future. It's a growing population. We're growing. We served, I think the average amount that we spent per client in fiscal year 21 was only $56. We do, some clients may get anywhere from $15 to $300 a month, depending on what their needs are. But overall, a lot of our clients our seniors were able to connect and stay with. We've had clients and seniors on our caseload for a number of years, because most of them, their income stays low, their health conditions aren't getting better, and they need that connection, and we connect with them.
But if they're on your program for years, what that means is that they are getting the assistance that they need to stay living at home, to stay living independently.
Absolutely.
So that's actually quite powerful evidence.
It is, and I agree. The fact that we're here and that they're not immediately going into a nursing home or hopefully in and out of the hospital is another issue, that we're able to provide enough support to keep them home and keep them from transitioning into a institutional setting.
So, Kay, can you give me that number again? You said 2021 you served 221 individuals.
Yes.
What was the cost per individual?
The cost per individual, I believe it was $56 per month per individual. That was the average. So if you compare that to the 225 per day for nursing home care, I mean,
Per month.
that's pretty, that's pretty. The 226? The 56 was per person for the fiscal year
Per person
average.
per month?
Yes. And we have seniors on our caseload that we don't provide any direct funds to, but we support by being there, helping them connect. And then we have others where we pay for maybe their emergency response system, medicine co-pays. It's really client by client based off the evaluation of the nurse and the team of what we can help them with.
And would that clientele possibly be seeking assistance from, we have a lot of other resources in the county. So while $56 is very low, if they're using other assistances, and you guys are helping coordinate that type of thing,
Right.
it's probably not just 56. It
Oh,
would be
absolutely.
Other programs that are available in the community?
Oh, absolutely. And that's the first thing we do. And I guess I should have stressed that more in the beginning, is this grant in particular, the criteria is we have to connect the senior with everything possible before we're allowed to use the grant funds. And part of our care plan is listing what we've done. Do they, have they applied for energy assistance? Did they, is home health coming out if they need home health? Did they roll in a Medicare D plan? Have they seen the SHIP coordinator to make sure they're in the best Medicare D plan for their medicines? So we list all that. What have they enrolled in?
So do you have like Corey was asking the average, from you guys, but if you were to look at the umbrella of services that are out there, and if you were to kind of add them together, what the average assistance per month might be?
We could, and that's a good question. And one of the things we actually developed is what we call a cost sharing. So when we sit down with the senior and their family, we say, what do you think you need, or what do you need? And then we actually have a cost sharing sheet where we put in like medical costs, rent, utilities, everything possible we can think of, and they put down, okay, well, yeah, I'm already getting food stamps. So we list that. I'm already getting energy assistance. We list that. And then there's a column for what they're getting, what they need, and then what senior care does. So technically, we could go back with every client and figure out.
It might be interesting going forward. You don't want to, go backwards, but it would be, I think, interesting to see that, and then it might help you all too to see what specific programs. That's like, okay,
Right.
rent is rent. That's how much money it is. Where are they getting that from?
Right.
The food. Or are they getting it from food stamps? Or are they getting it from someplace else? And then if there are programs that are available in the county that maybe people aren't utilizing, it might show us the holes too, where else they can plug that in.
Absolutely, absolutely.
Sounds like a budget to me.
It really is, and what we're doing is we're using like an electronic medical record because we're health, but we're managing these other things, and it's very challenging for us, especially when you get up to 200 plus enrollees, seniors. 50 or 60, it's kind of easier, but it would be great to have some software, plus to manage the inventory of incontinence supplies and medical supplies and all this stuff we purchase to support these folks. It really is an administrative challenge to run this program, but we've got a lot of spreadsheets, and it's so worthwhile, I think. And as the AIRS nurses would say, and again, those nurses are in every county, they like working here, and some of them have worked in other counties because they have something to offer these folks that sometimes have no other place to turn. Rather than do an assessment and say, you need this and this, sorry, I can't help you, or, that we can offer something.
And it's really a good example of a kind of a one-stop shop where we always try to use the term that there should be, one door that someone has to knock on to get services. And, you had mentioned how the need in Talbot County is particular, and part of that's because our demographics are, we have 30% of our population is over the age of 65, which is significantly higher than every other county in Maryland, and it's expected to grow. But it's really a very key program of the health department, something the county should be very proud of, and we're really grateful for your support, because it's really helping these individuals, stay out of the ER, the hospital, the nursing homes, and remain, active in the community, engaged in the community, and staying well and healthy. So thanks very much.
Yes, absolutely. So I guess part of why we come is because we do ask for the county council and the chief executive officer of the county council to sign off on our plan. It's been approved and reviewed by Dr. Maguire, Linda Webb, and Gary Gunther from Upper Shore. And once we get that approval, we're able to process and invoice the Department of Aging for our grant funds. So we appreciate your support and approval of us moving forward with what we're doing.
I do serve as the council's liaison to Upper Shore Aging, so I'm aware of some of the of these programs that you've been describing for us tonight, and aware of how much of what an impact these programs have. So thank you, and I don't have further questions. Although I will say that despite my engagement with Upper Shore Aging, this gave me actually a better overview than I've garnered so far of how this program works and how they mesh with the Department of Health. The Department of Health. I hadn't put all those pieces together, so thank you.
Mm-hmm.
Thank you, Mr. Risher. Any more questions, Mr. Pack?
No, I don't have any questions. I marveled every year that you all come before us to sign this document at how much you're doing with so little. Even with the $50,000 that the county gives you, I just did the math, you're like, there's $16,000, I guess, underneath your spending budget of $165, and it's $56 a month per individual. I mean, you're really stretching that out tremendously to get the services to these individuals that they need. So I just commend you, and I'm reading this, just kind of wondering how you're doing all this with just a shoestring type of a budget here. But we wish, I guess, we had, dare I say, more to give you. But
absolutely.
Coordinate all those other programs that are there.
But yeah, it just, and I have to give credit to the staff at the health department. This is a experienced team that's been in place a long time, and they really live for developing resources, finding resources, new ideas to support, new funding. We've developed some partnerships, got a few extra dollars here and there, it just, every little bit counts, and we try to push as much as we can direct to client services.
I'm going to ask a question. We had a quick briefing in the back regarding the opioid settlement from our county attorney. Do you have any data regarding how the opioid epidemic impacted the senior population here in Talbot County?
I think I'd have to go back and look, yeah. I think we do have some age delineated data on that, yeah. But I'd have to go back and look at it.
Okay.
Ms. Price, you
I'm
good?
good, thank you.
Okay, council, is there a motion and a second to approve the FY22 senior care plan as presented?
So moved.
Second.
Okay, we got a motion and a second. Madam Secretary, could you call the roll, please?
Mr. Callahan?
Aye.
Mr. Lisher?
Aye.
Ms. Price?
Aye.
Mr. Pack?
All right.
Okay, guys. Good job.
Thank you so much.
Thank you very much.
We really appreciate it.
Okay, we appreciate it too.
I'll have that tomorrow.
Okay, all right, let's move on to introduction to legislation. Madam Secretary, would you read the bill into the record, please, when you get a chance?
A bill to amend Section 19063.1A of the Talbot County Code in order to modify the composition of the Talbot County Short-Term Rental Review Board.
Okay. Mr. Thomas?
Yes.
Help us out a little bit with that, and explain that, please.
Yes, so this bill is proposing to amend the composition of the short-term rental review board to eliminate the requirement that there be an attorney with experience in real estate on the board.
Okay.
So it doesn't change the number of people serving on the board, it just takes out that one of them has to be an attorney with that experience. And as this is a zoning text amendment, because it's amending chapter 190 of the code, this will need to go to the planning commission for a recommendation and public hearing before it comes back to the council for action.
Okay. All right, then, council, could please raise your hand if you'd like to introduce this legislation.
Mr. Thomas, will it go back to the short-term rental review board as a whole? I mean, that board is also a board that offers recommendations back to the council. Do you know whether or not they will render an opinion back to us on the change?
I don't know offhand. I don't know if in the past bills regarding the short-term rental review board have also gone to them for their review recommendations if they have.
Not bills. I know we had a long, drawn-out work session with them regarding changes, and since this is technically a substantive change to that board, didn't know whether or not it would be something that we cared to hear back from them on. And they are an advisory board, but they're also a board that makes recommendations to the council from time to time.
I don't believe there's a requirement.
No, it's not a requirement.
Well, they can certainly, make public, come to a public hearing. I think the genesis for this is we've had a hard time, when we first put the board together 3 years ago, it was new. We wanted to try to get a cross-section makeup and thought that we needed someone, as an attorney, but, we have you, or we have other people to advise them. And it has honestly been a struggle to find somebody with an attorney in real estate, who's going to serve. And I think now that it's been a few years and we've been through first the formation of everything and what we did in 2018, and then we went through extensive changes, I guess, last year. At this point, as long as you have people who are knowledgeable and care about, the industry and also, and my screen just went blank, that should serve. And it's not like we don't have legal representation because we have the county attorney. So we just didn't feel like, that's why we're proposing this. We want to hear, from people if they think that we absolutely need to keep an attorney on there. But I will tell you, it has definitely been a challenge to find an attorney with real estate experience who's willing to serve on this board, because they do sometimes meet, sometimes twice, well, I guess it depends on the time of year, but it is something that it's not like they're just meeting once or twice a year. They're meeting at least on a monthly basis, and sometimes more than that, so.
And during working hours.
Yes, yeah, during working hours, that's key. So it is definitely a challenge, so we want people who are really interested in serving. We can accomplish that, we think, otherwise, or at least some of us think that.
Great. Thank you, Ms. Price. Madam Secretary, could you please announce a bill number and a public hearing date and time, please?
Yes, this will be known as Bill Number 1495, and the public hearing will be on Tuesday, December 14th at 6:30 p.m.
Okay. All right. We'll close, but public hearing. Okay, public hearing here. All right, Madam Secretary, would you please read the title of the bill of 1494 into the record, please?
Bill number 1494, a bill to authorize a capital project for the acquisition of certain equipment and an office trailer for the Repurposing Center located at 28128 St. Michael's Road, Easton, Maryland.
Okay. Mr. Edwards, would you like to come up? You and Ms. Nagel?
So, as everybody's aware, we've had this program and had 2 pilot programs for the Repurposing Center, and everything has exceeded our expectations, and it's going really well. It's just been a slow process with all the, the legal stuff that we needed to do, but I think we're getting there. And we need this legislation so that we can get this up and running as an enterprise fund. So, we're looking for your support to do that. Thank you.
Mr. Edwards, Sister Egley, you have anything?
No, I think Warren has described well
Okay.
what we need to do.
All right, okay, well, thank you, guys. Now I'm going to open it to the public hearing on 1492.
94.
Sorry, 1494.
92 has been the longest term. 92 has been the longest term.
Let's see. Okay, you're right.
I'm just going to remind council, when you have to be right on top of that microphone or the people at home can't hear us.
Okay,
And
thanks.
I'm literally right on top of it, so.
Okay. Okay, we're going to have a public hearing on 1494. If you wish to provide comments, please provide your name and address. I will give you 3 minutes if you want to speak, 5 minutes if you're talking with an organization, 5 minutes. All right, so that's what we're going to do. So, on this side over here, does anybody want to speak on 1494? On this side. Okay? Sitting over by yourself. You okay, Ray, over there? Huh? You all right? Okay. Would you like to speak on this? You don't? Okay. Okay. All right. So we don't have anybody who wants to speak on it. So that must be good. I'm thinking that's good. All right. All right. So I guess now I will close the public hearing on 1494. And the legislation will be eligible for the vote on November the 9th. So, go ahead.
Mr. Callen, if we could have Mr. Edwards back up here, just for the public's benefit, I might, just a clarifying question.
Okay, no problem.
The office trailer that this will fund for the repurposing center, this is what you need for the functioning of the repurposing center. This office trailer would ultimately contain whatever restroom facilities would be, or would they? Would this be containing the restroom facilities ultimately for the use of the center? But this does not create a sewer plan or a septic plan or anything else for that? Or can you explain just the functionality of that?
So even when the trailer is open, when we get that all approved, the trailer will only serve the administrative person working in the trailer for the restroom. And currently, everybody will use a porta pot, which is designated area. It's clean, fenced in, and safe. But we'll never have anybody coming in and out of the site going in that office to use the bathroom because of monies and that kind of stuff. There'll be a lab to do testing materials and basically an office to handle incoming, outgoing, and billing.
I simply ask because there's been public concern about the possibility of sewer being extended to the site. We've learned that now is not possible, and what I understand from this is that this is not creating a pathway for that to happen.
No.
I just wanted that out there for the public. Thank you.
Yeah, absolutely.
Mr. Risher, we have retained a firm to do a soil evaluation of the site.
Right.
We're awaiting that result.
They were actually there this week, so, I think it's going to take about a year to do an evaluation, wet, dry thing.
Wet season?
Yeah, and that's determined by the health department
Right,
based on the amount of rain, so it could vary monthly.
It was wet last night.
Yeah, it's wet right now.
So, Mr. Edwards, with this equipment, I know some of it has been there on, I guess, rental purposes or lease purposes, or Is there any emergent region or any urgency to move this matter forward today, or would the,
Well, it helps because we still have to get electric there, and we're waiting on all this to pass to get that approved. We have quotes because it's, it's a single source for the utilities, which would be Choptank Electric. It's a single source for the internet, which we need to operate the computer to do the billing and that kind of stuff. And we need the electricity for the well to keep the fire suppression. So, yeah, sooner the better for us to operate in a safe manner and a productive manner.
Mr. Peck, and Mr. Stamp is not with us this evening. He is aware that he would like to wait until November 9th for a council vote on this matter. Under county manager report tonight, we will be requesting council review of the rental of the pieces of equipment that Mr. Edwards needs to get up and running.
Okay.
Which will be a lease, a temporary rental agreement for 5 months.
Right. Okay.
Yes.
Okay, then, all right, anything else, council? All right, thank you, Warren, appreciate it.
Thank you.
Okay, so let's go, next up is Micah from the airport, and I think Jack's up here on the committee. You guys are, can you give us a rundown on how you guys are making out?
All right.
I'll give you 3 minutes.
Okay, good deal.
Okay, Mr. Pack told me that.
I can do it, challenge accepted.
Okay.
Good evening, welcome. Let's see here, once I get this cleared out of the way. Started, and,
If you go to slideshow.
yeah, slideshow, and from beginning. There we go. All right. Good evening, council. Jack and I are here to tell you this evening that your airport is doing just fine. We continue to recover through the COVID pandemic. Page 1 there, our capital improvements. This year, in September, we just received 2 grants totaling just over $500,000 to advance our runway safety improvements. Primarily, the large portion of that's going to begin our runway 422 geotechnical evaluation and topographical survey. I was here last winter requesting permission to go for that grant. It's been received, so we're getting our contractor issuing notice to proceed so they can start that project. Core samples to determine the soil makeup, so we can start to do, figure out exactly what it's going to take to build up that surface out on the airfield. And the other portion of that grant was reimbursements for easements, forest conservation mitigations, and wetland mitigation. So that money has been received, or that grant has been received this year. We haven't drawn down on those funds yet. We have 4 years to do that. And obstruction removal phase 2, that is a grant that we have open with the Maryland Aviation Administration to remove obstructions around the airport, namely trees is what we're talking about here. Just last week, we did resolve a fee issue with the town of Easton. I was here about a month ago asking for a letter of support. We were asking them to amend their code for a long-term solution. We did not they did not go down that path, but we did have a short-term solution. Remember I said part of the issue was they had stopped collecting fees, fee in lieu, but they made a decision that night that they would collect fee in lieu for us this year as we continue the conversation for a longer mitigation. So with that being resolved, we'll be able to start our project before the end of this year. And as I stated there, a long-term solution will be discussed with the town of Easton regarding, removing trees when we're being mandated by the federal government. Any questions about capital? Okay, business update. Airport revenue remains strong. Our robust business model, we're weathering the pandemic. We're looking at all revenue opportunities, advertising, looking at changing up some vending in the terminal. We're updating our contracts and bringing them up to fair market value as appropriate. All of our business segments, the charter operation, which I'll talk about in depth here in a minute with our stats, is really growing. General aviation's bounced back nicely. Our flight schools are flying, and our maintenance facilities are as busy as they've ever been. These are your fuel statistics for the end of last fiscal year. So as you can see, we recovered, we rebounded nicely from the COVID slowdown. When you look at the jet fuel total there, we are up 42% last fiscal year versus the fiscal year prior that was COVID impacted. When you look at the total fuel, that's gallonage at the bottom, 820,000 gallons. The airport's never sold that many gallons in its history, so we are definitely selling more fuel than we ever have. Combined, we're up 38%, and even the avgas, which is your recreational flyer, your single engines, they rebounded nicely at 17%. So we're moving a lot of fuel through the airport. Every once in a while, when I come in front of you, I like to take one statistic and kind of drill down, and so you can kind of really understand your operation. So here's 2020 and 2021 set beside each other through September. You can see the COVID-impacted year of 2020, we're only 45,000 operations this year, or, through September. This year, we're at 60,000. So we're up 30% year to date. Last year, we finished with just over 61,000. Our best year ever on record was 2015, with 74,581 operations. So we are definitely flirting with this being our best year ever. And I wanted to take a look at, really look at those numbers and see how we're doing this year compared to our best year ever, 2015. And I wanted to just look at the business user, our charter, people that we can really put our hands on, or, we can really, find that data, because some of it is hard to find. But we count those ops differently. We call them air taxis. We count them separately from everything else. And in 2015, throughout the entire 12 months, we did 2,074 charters, about 5 a day on average. This year already, through the first 9 months, we've already done over 2,500, so 9 a day, and that's going to continue. So we've almost doubled our charter user this year compared to our best year we've ever had. So charters, and that's what we're seeing across the industry. Folks who can charter, they're chartering, and that's what we're seeing here at Easton. Nearly double the charter operation from what was our best year ever. So that's good for us. People want to be here in Talbot County, and it shows in our statistics.
So Micah, just a quick question. So when you're, and that's phenomenal news. So what's that do to your staff when something like that doubles?
So, we have capacity built in. Most of this is really, luckily we have 4 fixed base operators that sell fuel, so there's capacity there. The ramp space that we expanded our ramp 10 years ago to accept this growth, and now it's here. We're actually starting to get a little tight on some of the ramp. The air traffic controllers, we bumped them up to 7 controllers about 2 years ago, and so now they're adequately staffed. So we've been proactive over the past decade to prepare for growth because we knew some was coming. A lot of it came quickly, but we had the capacity and we've been able to absorb it.
Can you tell the public, the air traffic control people, there's 7 of them, is that state driven?
So they are part of a program that's called the Federal Contract Tower Program. It's a federal program where we partner with the federal government and they pay for the staffing cost. Basically, we pay for the tower, the physical structure and the equipment, and they pick up the staffing cost.
That's great.
Yeah, it's a really good program. It's been around since 1982.
Great, that's great. I appreciate that.
Yep. Okay, airport facilities and improvements, just to let you know, lots going on out there in our terminal. We've updated some information boards. Of course, last year during COVID, we repainted a hallway, redid our bathrooms, brought them up to ADA compliance. We're about ready to repaint the main lobby. We're talking to the contractor. He's coming in next week. We're going to start getting a plan together for that. We're going to improve our signage and accessibility. We have a plan to update and improve the curbing outside and put in new handicap ramps. So we're doing small projects that make a big difference out there. Trooper 6 hangar is a hangar that's owned by Talbot County. We're making some improvements there as well. We just put some supplemental HVAC system in there in their break room and their bunk room upstairs, and we're looking at doing some office renovations. Of course, we're working with them to extend their contract for another 5 years as well. So that's our building, so we take care of that maintenance. And we're also taking strides to improve our security out there. And we're adding cameras to the terminal building, the airport office, and the control tower to improve the amount of area that we have under video, trying to get our access gates under video. We have nuisance issues that go on out there just like any other property, so we're trying to improve, our security so that when something does happen, we can go back to the tape and we can help law enforcement and we can kind of keep a better eye on things. So we have a project to update that. And we're also looking at updating the actual gate controller software, because we're starting to have a lot of failures of our gates. The system's 20 years old. The radio software that actually opens the gate and closes the gate, and the proximity card. So we're getting quotes on putting new software in, because realistically, it's a weekly issue where we have a gate failing or, something wrong with our system. So it's just, these things don't run forever, and it's been out there for 20 years. Community outreach, one of my favorite things to talk about. Easton Airport Day 2021 was our biggest event ever. If you were out there between 10 and 12, you knew that there was a lot of people out there. So it was a great event. We put the attendees somewhere around 5,000 from pictures that we have from overhead and talking to people on the ground. Of course, I want to give a big thank you to the county employees. We brought 10 county employees in to augment our staff that day to help us get everybody parked safely, and it was a wonderful event, a lot of positive feedback. So it was a great event, and we look forward to doing it again next year. We're just wrapping up our walk and talk series, and it's our open air, open house. It was something we did to bring people back out to the airport during this COVID time to where they could come out. We walked them on the ramp, showed them the airport operation, and gives the community time to actually ask us questions and get factual answers. We're going to do it again in the spring, and we're looking at rolling out something indoors this winter as well, where we can invite the public out to the airport in a comfortable setting, have some coffee, talk about the airport, and just really what we're trying to do is just have a constant transparency and a constant way for the community to visit the airport, understand the airport, and see what's going on with their airport. Also on community outreach, our ACE program, probably one of the most exciting things that we've come up with recently. We're going to launch what we're calling the ACE Passport that we're still developing. Basically, it's going to be a self-study type of thing for students where they'll go to a website, download some, basically a list of things to do, quite frankly, visit the airport, the control tower, some of the businesses, write us a report, and then once you turn that back in, we've raised about $3,000 through Midshore Community Foundation to actually pay for these students to take their inaugural flight. So they learn about the airport, write a report, and then we're going to pay to send them flying. So there's going to be more coming out on that. Civil Air Patrol is really growing their numbers. And we're also doing as much as we can to improve how we're keeping our community informed. We're using digital platforms. The website looks amazing. Jeff Langford's been phenomenal getting that out. We're putting out more press releases than we ever have, and we've developed a bi-monthly community newsletter that's been going out. So we're doing everything we can to keep the public informed about what's going on at their airport.
Thank you, Micah. Jack, you want to say anything? You're quiet over there.
No, I just want to say that one of the happy things I've been able to do is to visit or fly into many, many airports between Maine and North Carolina over the years. And this airport is right at the very top of the general aviation airports on the East Coast. It is a real asset to the community and to Talbot County. And a lot of the safety improvements that Micah just talked about grew out of a requirement by the FAA years ago, like 14, 15, 16 years ago, that we move that, relocate the runway threshold, the runway 22, away from the intersection of Airport Road and Route 50. And so a lot of the things you see going on, improve the safety now, flows from that requirement from the FAA. And we're making good progress on it.
Good. Thanks a lot, guys. You're doing a great job. Mr. Pack, say anything?
Yeah, excellent report. Always good to see Mr. Pettit here with us as well.
Yep.
One of the things on the obstruction removal report that's not there is, of course, the business center and the timeline for that obstruction removed. So Is there any updates on that from the FAA or MAA?
Mr. Pack, there's no updates. 2024 is still the year that we have programmed. The FAA has tentatively programmed $4.5 million for that fiscal year for us to begin demolition. So I would say it's one of those things that's like every year as we get closer, it becomes clearer, exactly what's going to happen because it's all discretionary funds with the FAA. So the fact that it's programmed on our ACIP and the fact that we're doing the soil samples and that survey in this year, I would say about a year from now, we should have a very good idea of exactly the time frame. But with that being said, I know we have concerns with the sheriff's office, right? And so we have plans to, if we needed to start demolition of parking lots in the warehouse building, we could do that first, and we could delay the sheriff's office portion. That's something that we've already baked into the equation because we know it's important to the county. So we're certainly standing by to do our part to work together to make sure everybody has what they need.
Good.
I know Warren back there is very interested in this project as well.
He's ready for his asphalt and his concrete.
His concrete for the repurposing center.
Yeah, so.
Okay, thank you very much, Micah.
Yes, sir.
Ms. Price?
I'm good, thank you very much.
Rusher? Okay, guys.
Thank
Appreciate
you.
the great report.
Thank you.
Thank you.
Thank you.
Micah, if you want to just stay.
Just staying, okay.
Yep.
Perfect.
Okay.
Great.
All right, next up is Jess with the county manager report.
Great. We'll skip board and committee appointments for right now and just go right to the first item for Easton Airport, which
Okay.
is to forward a letter to DNR in support of Easton Airport's Deer Cooperator permit application for removal of deer hazardous to airport operations.
Right, this is an annual requirement now. This was new just 2 years ago. I was here in January to request a letter of support. It's annual now. Although we just did our letter in January, I wanted to tee this request up soon, that way I can just get it in place by January 1. This is for our deer cooperator plan to manage the herd of any deer inside of the fence at the airport.
Okay. All right, then, council, is there a motion and a second to approve the request that's outlined?
Second?
Okay, we got a motion and a second. Madam Secretary, could you please call the roll?
Mr. Callahan?
Aye.
Mr. Lusher?
Aye.
Ms. Price?
Aye.
Mr. Pack?
All right.
Okay.
Great. The next item is request from Easton Airport to extend the contract for aviation fuel supply. We'll be requesting approval to renew the contract with Titan Aviation Fuels, formerly known as Eastern Aviation Fuels, for aviation fuel supply at Easton Airport for a 5-year term beginning January 2022.
Yeah, so we've had Titan, Eastern Aviation, they're rebranding now as Titan. We've had them for more than 20 years. Going into this year, the board and I, we discussed it. There's not a lot of companies that provide this service, right? Jet A, Avgas, these are boutique fuels. There's not a lot of competition. So I contacted FAA. We do not have a requirement to rebid this. So what we found it more beneficial to do was to negotiate directly with them for better incentives and the same terms. And so with this contract, what they're offering us are the same terms that we've had for the last 2 decades, which is advantageous to us because we only pay freight out of Baltimore, regardless of which terminal Avgas is pulled from. So even if they're pulling out of Chesapeake or New York and it's more mileage on them, we pay from Baltimore to Easton. And we've additionally negotiated several incentives with about $6,000 worth of marketing, and we feel it's a very fair deal, and we would like to extend the contract for another 5 years. And the board and myself are unanimous in that.
So move.
Second?
Okay, we got a motion and a second. Madam Secretary, could you please call the roll?
Mr. Callahan?
Aye.
Mr. Lusher?
Aye.
Ms. Price?
Aye.
Mr. Pack?
All right.
Thank you, council.
Thank you, Mike. Appreciate it. Good job.
Thanks, Micah. Going back to board and committee appointments, requesting council approval to appoint Anthony Kern to our Ethics Commission.
So move.
Second.
Okay, we got a motion and a second. Madam Secretary, could you call the roll, please?
Mr. Callahan?
Aye.
Mr. Lusher?
Aye.
Ms. Price?
Aye.
Mr. Pack?
All right.
And for the Hogneck Golf Board, requesting the appointment of Ron Venner.
So moved.
Second.
We got a motion and a second. Madam Secretary, could you call the roll, please?
Mr. Callahan?
Aye.
Mr. Lusher?
Aye.
Ms. Price?
Aye.
Mr. Pack?
All right.
Council, we're in receipt of a letter from the town of Easton requesting to transfer a portion of Flood Avenue owned by Talbot County to the town of Easton. This is a road that runs parallel to Easton Parkway, is located between Port Street and Glenwood Avenue. If council is supportive of the request, legislation would be drafted by both the town and the county to effect the transfer. And then part 2 of the request is to allow the town of Easton to begin repaving Flood Avenue now as part of its annual paving contract, and the paving cost would be at the expense of the town.
Council?
Is that a motion?
So moved.
This is an easy one. I so moved.
Yeah. Okay, I don't even know if we actually own Flood Avenue. It's like, have we even made that determination who owns it?
It doesn't matter, they're gonna.
The final sentence, we
Yeah,
can
but-
claim the interest.
You can quit claiming? Okay, yeah, let them take it.
Let them pave it.
Yeah.
We got a
Well,
motion.
what do you need?
A motion on
Did.
both
You
to
got that.
transfer and to pay.
I'll make the motion to
We already,
transfer.
you've been beat to the chase. We already
Okay,
moved and
okay.
seconded that.
There you go.
But you can vote aye.
Okay, we got a motion and a second, Madam Secretary. Could you call the roll, please?
Mr. Callahan?
Aye.
Mr. Lusher?
Aye.
Ms. Price?
Aye.
Mr. Powell?
All right.
Great. Warren, if you want to come up. We have a request from the Roads Department to enter into a rental agreement for equipment to be used at the Repurposing Center. The Roads Department is requesting council approval to enter into a rental agreement with GT Mid-Atlantic for 4 pieces of equipment, a grinder, a trommel, an excavator, and a stacker for a period of 5 months, which may or may not be converted to a purchase or lease depending if Bill 1494 is adopted by council when it's brought forward on November 9th. The lease agreements have been reviewed by the county attorney and finance director. The total for 5 months' rent will be $90,020, and there are adequate funds in the roads department budget for the rentals.
So moved.
All I have to say is that, you know, it's the equipment we need right now to take care of the immediate need with the forestry problem, so, with all the laws we've taken in.
Okay. What kind of, how much product you think you can produce roughly?
I'm afraid to guess, we probably have over 5 acres of just logs,
Okay. Okay.
a lot.
All right. So that 90,000 turn into 200?
I'm afraid to guess.
Okay.
I
As
can
long
tell
as
you
it
we'll
turns
exceed whatever you're thinking,
Okay.
as we have in the past.
That's what I'm liking.
Will it turn into something more than $90,000?
Yes,
Okay. That's fair.
absolutely, yes. That's all you had to ask, it just like that.
Well, I was pulling up, you know? Okay.
Well, you don't want it to go higher, you want it to go lower in actuality. Remember, this is the.
No, the revenue part we want
The-
rather than
yeah.
90.
The revenue.
The
Make
revenue
on it.
created from the repurposing.
We're renting something, so we won't be over that.
We want to sell enough product to pay for the rental.
We will be over that.
You okay? You straight?
I'm not looking at revenue numbers on my sheet, I don't know what you guys are looking at, but these aren't revenue numbers.
No, I just said, are you going to make more than $90,000 to cover the rental? And the answer was yes.
Oh, okay.
Yeah, we got yes.
Follow along now.
Okay. All right.
Is there a motion?
Do we have a motion and second?
So moved.
Okay, Madam Secretary, we got a motion and second, and we just got a second. Okay.
Did we have a third?
Mr. Callahan?
Going once.
Aye.
Mr. Lusher?
Aye.
Ms. Price?
Aye.
Mr. Powell?
Yes, all right. Yes.
Thank you, everyone.
Thank you, Warren. Appreciate it.
And then lastly, tonight, council, is just a reminder to the public about the Household Hazardous Waste Day being held this Saturday, October 30th, from 8 a.m. to 2 p.m., rain or shine. It's open to residents of Talbot County. It's being located at the former Hobbs Road Landfill, located in Denton, Maryland. More information is found on our county website.
Ms. Morris, is Mr. Brummel coordinating any transfer of those items over to that location?
I'm not sure, but I can ask.
I asked Ms. Roberts to look into that for me. Yeah, thank you. Right.
Yeah, Mr. Brummel was actually taking some materials over to the site today. But if you need to, we can have some materials taken.
Should I call him? Could you have him give me a call?
Oh, yeah, I'll have him call you.
Okay, thank you.
Do you have anything to add, Ray?
No, other than that, it's from 8 to 2.
Thank you.
That's it. Okay, good job, Jess, appreciate that. Okay, next on the agenda is public comments. Okay, you want to check that? This could be a first.
Well, it's close to
It
Halloween,
could be a
it might be
first.
ghosts.
Well, it's.
There might be
yeah.
ghosts out there.
Yeah.
It's almost Halloween.
It's not April 1st, so it can't, No, okay, that's good, man, we are making headway. Thank you, Nancy. Okay, good night. Okay, we'll end with council comments. Mr. Vice President over here.
I have nothing further this evening.
Okay. Ms. Price?
Nothing further either.
Mr. Pack?
Good. Thank you very much.
You good?
No comment.
Okay. The only thing I would say is, once again, I was really sorry to hear about Jeff Parks, because he's got a little bit in my heart, and I really, really just learned about that this afternoon. And great colleague. We did a lot of firefighting together, and a lot of great memories. So I wish his family well, and his sons. He's got 2 sons, and I really wish him well. And then, last thing I want to do is Mr. DeVillio couldn't make it tonight, so his son is got COVID, and he was exposed to it too. So we wish the family well, and hope everybody's okay, and hopefully everybody will be in good shape next week. So I want to wish the family well. Thank you.
Take us out?
Yep.
The County Council's next meeting will be held on Tuesday, November 9th, beginning at 6:00 p.m. The council will be convening an open session at 4:30 p.m. and immediately adjourning into closed session to discuss real estate, legal, and personnel matters as listed on the statement for closing that meeting. On Thursday, October 28th, Maryland Department of the Environment will be holding a public hearing on the Trap East or Lakeside Water Treatment Plant Discharge Permit, 19 DP 3460, beginning at 5:00 p.m. in the curling rink located at the Talbot County Community Center, 10-0028 Ocean Gateway, Easton. The meeting is open to the public. On Tuesday, November 2nd, the Maryland Department of Transportation will be hosting the annual Consolidated Transportation Plan meeting with Talbot County, beginning at 3:00 p.m. The meeting will be held in the Y Oak Room, located at the Talbot County Community Center, 10028 Ocean Gateway, Easton. That meeting is open to the public. If there's nothing else to come before us, motion to adjourn would be in order.
Okay. Okay, we got a motion and a second. Madam Secretary, could you call the roll?
Mr. Callahan?
Aye.
Mr. Lesher?
Aye.
Ms. Price?
Aye.
Mr. Pack?
All right. Okay. Thank you. Good night, everybody.